So, in terms of your views on mentorship, right? What advice can you give to those nurses that are just embarking on their journey as fresh graduates and then be in this situation where there's so many challenges dealing with COVID and also with the ongoing shortage that's happening, especially in critical care areas?
Well, I think that, certainly throughout my career, there have always been challenges. And I think it's just something that we're going to continue to encounter with newer graduates that are coming on board. Some of them, as you know, may not have had the amount of clinical exposure that because of COVID, they just really didn't have that opportunity. So being mindful of that as a nurse leader, as a director of nursing, to make sure that we are looking at it from the perspective, the graduate that we're seeing now is different than the graduate that we might have seen 3 years ago because they don't have that clinical experience. So really trying to give them a good solid foundation during their orientation. What I tell the new graduates is that really to be like a sponge, just observe and absorb what's going on around you. And, really, it will take you a while to craft your expertise and your skills, but to sort of look at things sometimes like a menu. And, you pick and choose things that will help you, and you will learn to develop that in your role. One of the things that I feel is most important as a mentor really is to listen. And yes, sometimes people want your expertise, but you really need to listen, because sometimes as somebody speaks and tells their story, they are working to solving their problem. They're talking it out loud, and sometimes it just feels better when you say it and you say it out loud. So I think that's one of the most important things as a mentor and as a mentee, to that mutual opportunity to listen to each other, and to listen not only to the spoken words, but to listen to the actions, to sense what's going on, and really use all of your skills when it comes to being with somebody, and especially when you have that relationship, to be intuitive and perceptive, and